Welcome back to another episode on Impact Your Revolution with me, Coach Andy James, and I'm joined by Dr. Jill Hamilton yet again on another one of our episodes, our MedFit episodes. We're going to be talking about gut health today and how this is impacting people now, as well as what the NHS and GPs are going to be looking at in years to come. But where did we start with gut health? Because I know for a fact right now there's a lot of information out there that's confusing people with regards to the amount of information they should know about how to improve or what they should be looking out for when it comes down to their gut health. So I'm going to talk about some things from a health standpoint, and Dr. Joe's going to be talking about some things from the medical side of things. This in itself would be great guidance for you to take on board when maybe considering issues that you're facing right now, improving your overall health as well as your gut health, or maybe issues that you're dealing with that you need to speak to a GP about. So, Dr. Jill Hamilton, we're back on another MedFit episode, and this one talking about gut health. I know right now that there's there's a world of information that's being thrown at people, having people wanting to be more mindful about how they're looking after themselves, how their gut health's impacting them. I'm going to pick straight up from what the gut's actually doing. Now, I know that we've spoken about this and we've said numerous times that it is now being identified as the second brain of the body, and because it has that much to do with how the body functions. From your perspective, how are people treating their gut health right now? Is it a priority to people, or are people quite passive with how they're looking after their gut?
I think you're right about actually, you referred to it as a second brain. I think definitely doctors and scientists are thinking about it as another organ. Okay, so it's as important as your liver, your brain, your kidneys, and things. So it absolutely is being highlighted in lots of social media at the moment, and lots of TV programs are having episodes about it. So I think that's why it's quite important to talk about. In terms of, I think we all know, and I think we always have known, that if you put rubbish into your body, you can't expect performance, whether that's mental, whether that's physical. But I think we're understanding a bit more now. And I think people are realizing that it probably affects your mental health, that it will affect any gastric issues, things like that. So I think people are definitely taking it a bit more seriously, and it is something that people are coming to me to consult with now, whereas I think probably 3 or 4 years ago people didn't really think about it as much.
Something I like to look at when we're thinking about the body in general is we think about the brain being the center that makes the decisions. But the gut is really the next port of call when it comes down to how we function. Because, like you said there, what you put into your body matters drastically on what it can do with what we put in. So if we're demanding better energy levels and we're not seeing that, we have to surely be looking at the quality of our diets, how we're surrounding the benefits of improving gut health, or the things that we're not paying attention to. Being the second center of the body now, and how the body's being able to function, having the gut in either a positive or a negative environment. We're going to talk about the microbiome a little bit. So the microbiome is the environment. So it's the bacterial environment inside of the gut that we need to be able to process food, send signals to the brain, get the responses that we should be getting so the body functions in the ways that it's supposed to be functioning. If we're doing certain things, so low quality food, we're overstressed, we're sleep deprived, and all of these other things that we tend to find people in patterns of these days because of the lifestyles that we live. How are things like that impacting the gut microbiome, and what is it people are kind of experiencing from having a low good bacteria in the microbiome?
Okay, so I mean, I think probably the easiest way to explain it is a bit like it's a garden. Okay, and you got to sort of like you put fertilizer on plants and you'd water plants and you'd look after them. If you don't look after them, they'll just die. And I think that's sort of similar for your gut microbiome. Now, the number of cells in your gut microbiome massively outnumbers, I think it's by about 10 to 1, the cells that you have in the human body. So I think once you know that, you think how important it is to look after it. And if you don't look after it, it's going to have effects on your nutrition. So actually, you know, if you're if you're eating some good foods and then you're having a lot of processed foods on top, you're not going to absorb all the nutrients that you should be getting from the good food that you're having. It's going to definitely affect your behavior. And I think that's probably something we'll touch on a little bit later on, is this link between your brain and your gut. So your gut does signal to your brain when you're hungry, when you're full. And it will also, we think at the moment, there's a lot of research going on about psychobiotics, which are medications that, working in your gut to treat your mental health. So definitely behavior can change. And then also how your body works. So your immune system. So if your gut microbiome isn't working properly, your body becomes what we call pro-inflammatory. So your immune system is sort of on high alert all the time. And that can create a lot of other problems, and it can, increase risk of diseases. So things like your inflammatory bowel disease, we think it may increase your risk of Alzheimer's, and obviously lots of other gut issues and things.
I mean, you kind of led me straight into the next question. From health, on the health side of the fence, we always look at how we're setting the body up to work optimally. And I don't want to sort of draw too much attention on the word optimal, because that's very unique to every single person, but more along the lines of, if we're looking to improve how the body processes the food that we put into it, we have to be mindful of the gut bacteria. And I think that's why we stress so much about wholesome foods that have naturally occurring enzymes in them to give the body the best fighting chance to set its own microbiome system up with how it can process that food that we're consuming. But if we're taking, say, antibiotics for illnesses prescribed, or whether we're maybe having a few drinks a week and alcoholic drinks and those kind of things, all of these things that we're doing that are, day to day, we kind of class them as normal behaviors. They're having a negative impact on gut health and how we can actually help ourselves move forwards with producing a proactive environment inside of the gut. And I think that's what this really comes down to, is that proactive environment inside of the gut. Because while you can do all of the things that pays attention to having good health and good gut health bacteria, there are so many things as well that contribute towards the negative side of things. And I think a lot of people can rule out just the day-to-day things that impact how the body's set up. You mentioned things like IBS and other gut issues that we can have, illnesses that arise. How are people finding that improving gut health, just even in small margins, without having to go down the routes of excessive medications and things like that, just by improving their gut health a little bit, is it improving the quality of people's lives that you're seeing when people are coming to see you? Because from my side, in the health environment, I drastically see the improvements that somebody has when they look to improve their diet straight away. They're processing food better, their energy levels go up. What they can physically do has the outcome that we're looking for. But on the other side, the illness side, the bit that people struggle with, because I know bloating is a big thing for people, and it makes people feel really uncomfortable. IBS, Crohn's, those things, those illnesses are all impacted by how the gut health is set up. So are you seeing a big difference in, just by small improvements in gut health, that it's having on the quality of people's lives without having to go down the routes of excessive medication?
Um, Yes, and I think obviously in general practice, people come to us before they obviously, if we can't help them or sort things out for them, they then go on and see the specialists. And everyone knows now that there's quite a long wait to see any kind of specialist in the NHS. So sometimes we have to really try. So when we've done all the traditional tried and tested things, especially for something like IBS, we've ruled out anything sort of sinister. We are now going down the lines a little bit more about, thinking about your diet, thinking about your gut health, what you're doing. I know certainly 5 or 6 years ago, I wouldn't have really thought about saying to somebody about, if you've had antibiotics, why don't you think about taking some probiotic medication afterwards? So sort of the capsules that you take that, if you've had antibiotics, they wipe out a lot of the bacteria, including the good ones, that you need to get back into your system. So I know certainly I'm suggesting that quite regularly to people if they're having problems with their gut, and also really sort of having deep dive conversations with people about what they're eating, when they're eating. And I think you sort of touched on it a moment ago, didn't you, about alcohol? Anything that causes stress on the gut, and we all know that alcohol is a toxin. That is also going to cause problems with your gut and potentially wipe out some of the good bacteria that's doing the good jobs. But also we have to think of other things like sleep and stress levels, because that is also going to not create, it's a bit like a garden, isn't it? If you have a toxic environment in a garden, your flowers aren't going to grow, using that analogy again. So yeah, I think in general practice, it's, these kind of conversations are creeping in a lot more than they would have done previously.
So I know, again, I mean, I touched on this, but you also mentioned that it's the signaling that comes from the gut. We can think about the food that we're putting in, how it's impacting the environment of the gut, but what from there? Like, the environment of the gut does its job, but we forget about the signals that the gut's then sending back up to the brain. You mentioned the hunger hormones, leptin and ghrelin, and how that's impacting on how the brain receives the signals. But also, it's the mental health side of things. We know that I'm a huge advocate on mental health, looking after how you look after your mental health. If a person isn't aware that their diet, their gut health is poor, so if somebody is suffering with maybe IBS, or they've got uh, maybe sort of a drastic case of bloating, discomfort, those kind of things, that's a clear indicator that there is something unhappy inside of the gut in itself. But would you likely see somebody that is struggling in those ways also being impacted with their mental health, because signals are being interfered from the return signal back to the brain from the gut? In that sense, because mental health is such a big thing for me, I can kind of relate to the medications that I was on going through my mental health battles. And it didn't even cross my mind at that point of, well, what about how my gut's being set up? How am I looking after the internals of my body? I'm taking these medications because that's what I've been told I need to take to manage my mental health. But I was not aware of how my body was processing the food at that point, because of the disruption and then the signals that I'm receiving because of different types of medications. It wasn't until I think I just gravitated towards improving the quality of my diet, just because I had to have health as a focus for me to have an anchor to be able to help get me through my mental health battles. When that improvement in my diet combined with that medication, I saw drastic improvements in how I was physically feeling day to day. But for somebody that's not aware of that, where would you suggest somebody start if they are experiencing, say, you know, disruptive gut health? They know that maybe their diet's not particularly the best. What would you suggest for somebody to say, right, try this, this, and this first? So if somebody was to come into the practice and say, I'm always bloated, I don't feel like I digest my food very well, I'm getting acid reflux because I just feel like I'm constantly not processing foods. I feel really uncomfortable, low energy. What do I need to do to get away from this feeling? Because I just don't feel like me anymore.
Okay, I mean, I think there's some interesting points there you've raised, because I think the first one I would say about is when somebody is unwell for whatever reason. So whether it's your mental health, whether you're suffering with chronic pain, or you're really struggling with another disease process, or if you've just lost a relative or something, or if you're just extremely busy and highly stressed, you're going to be just getting through the day to do what you need to do. And maybe sort of, your food and your diet, you're eating to live rather than, living to eat type thing. So you will just be having food to have food because you're hungry and satisfy that need without maybe thinking any more about it. And I think when people are at a particularly low ebb, for whatever reason, probably things like, if they haven't really got the motivation to get out of bed and get dressed, and sometimes with people with severe depression, even that seems too much. So then trying to tell them to have a largely plant-based diet, and some of these things are quite expensive as well. So, I think it's actually just trying sometimes to find a way in with people, and just making it a really small change sometimes, rather than trying to get them to go from a very, very poor diet to maybe a high quality diet. Just planting that seed sometimes with people is important. So I think, first of all, I think mentioning that if somebody's in a difficult situation in their life, just acknowledging that actually one of the things that's probably going to be first to go is your diet. And then when people do come and see us, I suppose it's getting them into that right and correct mind frame about priorities. So, are there things that people are stressing about that maybe they can just, put to one side for a minute and think, yeah, actually that is important, but actually other things are going to be more, what's going to get me to the place I need to get to first. And I think, not criticizing somebody about having a heavily processed diet with, what I might think of, God, I'd never eat that. Actually going, right, okay, so you're going to have some of that in your diet because it's quick and easy, but let's just maybe introduce a few whole foods a couple of times a week to start with. So I think it's actually seeing where that person is in, at the time, and then managing them appropriately. So I think that's one thing. The other thing that I'd go to is if somebody has gut issues and bloating and things like that, probably my first thoughts would be actually just ruling out that there wasn't anything else going on first. Okay, so if somebody comes to you and they're pretty fit, they're pretty active, they don't have any of those issues that we've maybe discussed a moment ago that are at the forefront. So, you've got somebody that's pretty happy, pretty well physically, not necessarily massively stressed, but they then come to you with a lot of gut issues. What I would be doing is taking a really full and thorough history, examining them. Maybe I might, take some samples, get them to do some urine and stool samples, some blood samples possibly, just to make sure that, there isn't an underlying issue that we're missing. And I think once we've excluded all of that, then that's the time to really take a deep dive into their diet and things like that.
Okay, so when we're looking at long term, and we know that the body changes over a period of time. I mean, I know over my lifetime, I'll use an example, and I think this is quite a popular example in the social media world as well, is you see a lot of people talking about removing certain food groups out of their diet to improve the way that they can lose weight. Now, your gut microbiome does impact how you physically lose weight. If you've got a very, very poor, I don't want to say negative environment, but if it's not supported in a healthy way, then it is going to be more difficult to try and lose weight if you're negatively set up with poor gut health. If you can improve your gut health, weight loss does become a lot easier. Over the years, naturally, my gut microbiome has changed because I never used to have an issue with specifically milk growing up as a child. I'd go through pints of the stuff. My mum was always telling me that there was never enough milk in because it would be the first thing that I'd go for with any kind of drink. And it was something that I had in my diet for majority of my life. Then I started to, in my earlier years of getting into the fitness industry, started to understand more about dieting and those kind of things. I went through a period where I did actually cut out dairy. And that was just because of maybe conflicting information that I'd come across. Now, fast forward 15 years, and now I have a low intolerance to milk. And I know for a fact it's because partly that naturally the gut microbiome does develop and change and evolve over those years as well, but also me removing that food group completely for quite a long period of time and then reintroducing that food group triggered a low intolerance in how my body can process that kind of food. And there's a lot of people in the world now that believe by removing certain food groups that they've never had an issue with in the past, but because they've heard it for whatever reason, they remove these food groups, expect to see a health result or health change. Maybe they don't, or maybe they miss milk, or maybe they miss a dairy product. They reintroduce it, and now all of a sudden they've got maybe low IBS, or they've got some kind of intolerance happening, and that their body doesn't process that food as well. And they're scratching their heads thinking, well, I never used to have this problem. Now why have I suddenly got this problem? What's your standpoint on how people are consuming that information that's making them maybe make choices that they don't need to make? Because I know, being a coach, being somebody that has looked after a lot of people over the years, I'm a huge advocate on keeping as many food groups into somebody's diet as physically possible, because I want somebody to live life with the full experience of what's on the table in front of them, and then they can make their own choices around the food that's in front of them and how that works for their body. If you remove that food group, say, anything that's gluten, wheat based, dairy based, all of the typical, stereotypical, should I say, food groups that people are told to remove, and then you reintroduce them, and you now have bloating, you have gut disruption, you have a microbiome that's not working with the way you want it to work. Is there a way of coming back from that, if in your experience, or is this something that is, okay, maybe I have to manage this out slightly? Because the reason why I ask is I've worked with people over the years that have taken this to the extreme, and it's actually led them down the routes of having to have medical, like long-term medical, I don't want to say intervention, but they've been on long-term medication for whatever reason, because of dieting choices that they didn't need to make, but they did make.
I mean, that's quite a funny one, actually fairly personal to me, because I think when I hit 40, I went on quite a big sort of healthy and wellness sort of change, and drastically changed my life. And then I think, even me as a medical professional, I went down these wormholes, and then at one point was thinking, gosh, what am I doing? What can I eat? I think I've, things like going dairy free, I've done that as well. And I think for me, that's been quite helpful. But then one of the things I started noticing was, when you start looking at all the different milks and things like that, is, oh, there's quite a lot of additives. There's quite a lot of chemicals in some of these plant milks and things. And then I was thinking, is that actually worse for me than having whole milk that just has milk in it? And so I know certainly I then started really trying to go towards things that were plant-based, that were had minimal chemicals in, but then they are quite expensive, and like milk, they've got a limited shelf life. And then you start, I think I started looking at, different sort of packages you can get, tests that you can get over the online, things like that. And I think you then get a lot of conflicting information, and then you talk to friends and family, and then other people start cutting things out, and you think, oh, if especially people if they're a bit older, you think, oh, they actually need their calcium, they need their vitamin D. If you're cutting it out, make sure you're replacing that calcium and vitamin D. So it really becomes quite difficult, and your head can feel like it's going to explode about what can't I eat. So what I would say is, I think if you're getting symptoms of something, and I always tell patients, keep a food diary. Because if you come to me and just say, I'm getting this all the day, I've got no idea why, I probably won't have an idea as either. But if people keep a food diary, and you can pinpoint things, and I tell people, don't start cutting things out, because if you start cutting 10 things out of your diet, you don't know what's going to be the magic thing that is the cause. So, I will get patients coming to me, and they'd say they don't think they've got a dairy allergy, but actually in their food diary, it's every time they have milk or every time they have cheese. And then actually, that when they pinpoint it and they take that out of their diet for, say, a month, they can see a massive improvement. The other one tends to be things like gluten and things. So people can have a gluten sensitivity, or they can have actually celiac disease. They are two different things. But actually, some people may not have celiac disease. They may have just an insensitivity, and they find that when they are not eating sort of bread and pasta, they feel much, much better. But I think just go through one or two things and cut out, rather than just sort of cutting out big food groups. And I think that's fine to do that if you are having symptoms. If you're somebody that's not having symptoms, I would say just try and follow a healthy diet that's really varied. In terms of fruit and vegetables, have as many varied, really colourful fruit and vegetables as you can, because they contain prebiotics which feed your guts. And if you're not getting symptoms, just try and have a big variety of different foods that you eat, ideally that aren't super processed. So things with less than 5 ingredients in, and things that don't have lots of chemical sounding names in them. But if you are having symptoms, keep the food diary, only eliminate, say, maybe one or two things at a time. And then they might be things that you can then reintroduce back slowly. So, things like milk, you might find that stopping all dairy really helps, but actually you quite miss the milk, or, cheese occasionally. And then what I would say is just reintroduce it really, really slowly. And if you're able to do that, fantastic.
That's exactly what I've done. Yeah. So I've actually, I did the intolerance and allergy tests. I got the confirmation that there was a low intolerance to specifically milk, and cheese. And all I did was I completely removed them. I did feel better, but I do miss those elements of food in my diet. And I now know that I can actually reintroduce them. And it's not so much there's a complete intolerance, there's a mild. So I can actually have a small quantity of, so, maybe a cup of tea with milk in it, or some cheese on something else. That doesn't trigger any kind of discomfort. It's when I have it in larger quantities and my gut's having to do a lot more work with that one singular thing in there. So, like you say, if you're consuming it with multiple different types of food groups, it's not generally too much of an issue. But it's when it's just, for me, it's just that one sole. If I was to go and have, say, an entire glass of milk, that would massively disrupt my stomach. But I could go and put a bit of milk in a cup of tea and it wouldn't cause me a problem. So it's just knowing, I think, where those boundaries lie. And that food diary is 100% one of the things as a coach as well. I would tell any of my previous clients to say, go and keep a food log for 1 to 2 weeks, track everything that you are consuming, and then pinpoint maybe a couple of things in those meals that an hour or two, if you were feeling a certain way with your gut, highlights the things that you feel like would be contributing towards how it's making you feel. Then within that 2 week period, have you eaten that food again? And did you get the same response again? And that's usually a clear indicator that then there is something that you need to pay attention to inside of your diet.
So I think that's key. I think if you're somebody that has had symptoms, it is really sensible to eliminate that particular food out of your diet. So for myself, actually, I spoke to my mum, and there'd been a clear history that as a child I didn't tolerate milk very well. It used to make me quite sick. I didn't like cream, all those kind of things. So there was a history of that. And then actually, as an adult, I probably just had whatever I wanted because I wasn't really thinking about it. But I think where I would just, tell people to be cautious is if you don't have any symptoms, don't go, cutting out massive food groups just because somebody on social media says you need to, because, milk and dairy does have a lot of good stuff in it. I mean, if you're vegan for sort of ethical reasons or religious reasons, and that's different. But I think, I would just be quite cautious about faddy things that you hear on social media. I think anything that is restrictive or is very difficult to do probably isn't that healthy at the end of the day.
Yeah, no, I agree. So just to wrap up then, in the next 5 to 10 years, what do you predict? Rather than not, I'm not going to say this is absolutely going to be the way that it moves going forwards. But what do you think is going to be the prediction of people looking after themselves, coming to a GP, looking at their health, looking at their gut, and going, I need to focus on what I'm doing with my gut health before I start worrying about protein shakes, supplements, fad diets, and all of these extreme measures? Because if I'm not paying attention to the second brain of my body, which has a very clear, big outcome on what happens with my body, what do you think we're going to be seeing from the medical community in the next 5 to 10 years on how people are improving their health this way?
Okay. I mean, I think there's a couple of things from some of the basics. I think, probably, we will be, advising things like, having normal deliveries where possible, because we know that actually that sets you up, because as you're born and you're going through your maternal tract, that you actually get a lot of good bacteria that sets you up for life. So I think, cesareans are absolutely needed in some situations, but obviously, if people are able to deliver naturally, pushing that agenda, I think will be helpful. Also, breastfeeding again, where it's possible. It's not always possible, but we know that babies get lots of good bacteria from breast milk. And then sort of thinking about actually just our day-to-day sort of long-term condition management in medicine of people's long-term conditions. I do think that maybe in the next 5 to 10 years, where we go and have blood tests and we have other markers taken at the doctors, people will be going and getting their gut health tested, and this will produce quite individualized care. And I think, we do know that if you've got certain bacteria in your gut, that, that's positive, and other bacteria in your gut can cause negative consequences. So I think it will lead to quite a lot of individualized care for people. I think we're certainly seeing that now with lots of other sort of research and private companies going on. I think we've talked about things like the Zoe app and things like that. I mean, I would say that's still very much research at the moment. That's not really in current medical practice. But I think when we get all the results of this type of research, and if it is found to be beneficial, that will then trickle into NHS care. But I do think that is probably likely in the next 5 to 10 years.
No, I agree. I think everybody's health approach is an individualized approach. Trying to take a blanket approach to a lot of people's health and approach it in a one-dimensional way usually doesn't give the result that somebody's looking for. And I think that's just something that's become very evident in the years that I've been in the fitness industry. Is you can give to a level a blanket approach, but as things start to become more personalized and individualized as you move forwards in bettering your health, you do have to be more aware of the bigger picture. It does move past the generalization of health.
And one of the other things that I do particularly focus on is child health. I think by the time you reach adulthood, these things are quite difficult to unpick as you get older. I think when you're a child, I think, you're setting up your children for the rest of their life. So I think that's one of the other things is really trying to make sure that, children are having balanced diets, that, yeah, they can have their treats, they can have some processed food, but that doesn't make up a huge amount of their diets. And I know it can be really difficult for parents, busy mums and dads, that, lots of competing really important things they need to get done, and especially have a child that might be quite restricted in what they're eating. But I think that's something that's really, really important to sort of try and get across, that children, of course are going to gravitate to, some of the processed foods and things like that. And, but really trying to push good, healthy, whole foods and a really varied diet with children, because you are setting up their gut microbiome for the rest of their life.
Yeah, generational. It's got to be, you've got to start somewhere. I mean, if it's going to be a struggle for you yourself to improve where you're at in your life, there is nothing stopping you from passing that information down and installing good information into the generation that's coming up behind us. I think that is an absolutely brilliant place to be able to finish and wrap up this podcast on, because it is about what you do moving forwards. It's about the choices that you make. You are in control of what you're feeding your gut. Some things are medically, we can't control the environment that it's set up in, and we do need that support with it. But if it is just around a whole health approach, there are options out there that possibly haven't been considered. And I would massively encourage you to go and consider all of these options before you start jumping into, am I going to create another problem for myself by adding, removing, going down certain fad dieting protocols, etc., without the complication that's needed. I'm going to keep it simple. pay attention to what you feed yourself, pay attention to the education that you pass on to the next generation. Health can be improved from the next decision of food that you consume. If you are struggling with something that is dietary related, that is making you feel a certain way, keep a food diary. Keep a food diary for around about 2 weeks. See common foods that have similar responses. And if you feel a certain way, highlight the food. And if you've got that information there, you've already saved yourself a whole bunch of time going to see a GP, because you will help the process and get a result 10 times quicker if you do need somebody to help you medically along the way as well. So thank you for all you contribute towards these podcasts, Dr. Jill. I do appreciate it. And I know for a fact there's people that do listen to these that they raise their hand, they say that this was informative. So if you are one of those people, by all means, leave a comment down below for Dr. Jill. Just say if the information that we've spoken about has benefited you, helped you, or given you a bit of guidance and clarity. That being said, we've got another one planned in a few weeks' time. We're not going to tell you what it is just yet, but I think I've got a feeling I might hand the reins over to Dr. Jill on this one and put the spotlight pointing this way for once and ask from the medical approach into the health world my standpoint on a few things. So this might be something different. But until next time, thank you, Dr. Jill.
No, I think you covered and summarised everything really well with that. And I would just say that, what you put into your body, think of whether that's medications, whether that's food, try and make sure that you know what you're having and why you're having it.
Awesome stuff. Right. Appreciate you for being here. Catch you in the next one. You take care. Have an awesome day.